Assalamualaikum warahmatullahi ta'ala wabarakatuh. A pleasant day to each and everyone. So in this video or audio, we will discuss the chapter 15 of Community Health Nursing 2, which talks about the e-health in the community setting. So pag sabihin natin e-health, it stands for electronic health. So ano ba yung stand ng electronic health dito sa community? Is it widely acceptable and madali ba siyang gamitin as a nurse sa isang community? So innovations in healthcare are continuously introduced. Hindi lang kumbaga sa everyday lives natin, even sa healthcare, madaming mga innovations ang nababago. Okay? Healthcare providers apply best practices from latest researches and use appropriate tools to enhance the quality of healthcare delivered. So, hindi lang tayo magsastock sa kung anong resources ang meron tayo. Siyempre, dapat nag-a-advance din yung mga services na binibigay natin sa community. So, we have what we call information and communications technologies or the ICTs. These ICTs are becoming indispensable tools in addressing some challenges in healthcare. So, nagagamit natin itong mga information and technology in addressing the problems within the community, especially on the health education. So, ICTs are defined as diverse set of technological tools and resources used to communicate and to create, disseminate, store, and manage information. So these technologies include your computers, okay, the internet, the broadcasting technologies such as yung nasa TV or radio, and also the telephony. Pag sabihin natin telephony, we use the telephones, okay, in addressing the needs of our patient, especially ngayon nagkaroon ng pandemic. So nung nagkaroon ng lockdown, hindi makavisit yung mga patient sa mga doctors nila. So paano nila yon ginawa? Paano kumaga hindi mapabayaan pa rin yung follow-up check-up ng ating mga patients through the use of their phone, through the use of their laptops. They had Skype, they had Zoom meetings, okay? Tinatawagan nila, tinetext nila every now and then yung kanilang patient. So, malaking tulong actually yung e-health sa ating community. So, ano ba talaga si e-health? So, e-health is the use of ICT or yung uh, the information and communication technologies, yan yung paggamit natin for health. So, on May 25, 2005, during the 58th World Health Assembly or WHA, a resolution was adopted by the World Health Organization member states recognizing e-health as the cost-effective way of using ICT and healthcare services, health surveillance, health literature, health education, and research. So, ganun kaimportante at nabigyan ng role yung e-health sa community. So, given the extensive capabilities of ICT, e-health can be considered in any of but not limited to the following. First, communicating with the patient through teleconference, electronic mail, short messages services or yung SMS or text messages. Another capabilities ng ating ICT is to record, retrieving, and mining data in an electronic medical record or EMR. And lastly, providing patient teachings with the aid of electronic tools such as radio, television, computers, smartphones, and tablets. That's why may mga rural health units na makita nyo may mga television silang nandoon or tablet na nandoon yung mga ginawang video para to be used as a tool in rendering health education. So, e-health is often confused with telehealth or telemedicine. It is the overall umbrella term eh. Pag sabihin nating e-health, it is the umbrella term na kasama dyan yung telehealth, telemedicine. According to the World Health Organization, e-health encompasses three main areas. So, ito yung tatlong areas na in-encompass ng ating e-health. First is the delivery of health information for health professionals and health consumers through the internet and telecommunication. So example lang natin yung mga websites ng DOH, websites ng W Health Organization na pwede mong makuhaan ng health education. So using the power of information technology and e-commerce to improve public health services. For example, through the education and training of healthcare workers. So during pandemic at nagkaroon ng lockdown at hindi na basta-basta madali yung pagpunta in one place to another, nagkaroon ng mga seminars or webinars. Pag sabihin natin webinars, mga seminars na ginagawa through internet. Okay? And lastly, the use of e-commerce and e-business practices in health systems management. So what is the power of data and information? So nurses are knowledge manager. You all know that, diba? Isa sa mga roles natin ng mga nurses is we manage knowledge or we manage data. We manage information of our community members. So they constantly process raw patient data into valuable information to deliver evidence-based and individualized intervention. It is imperative for every eHealth practitioner to know the importance and difference between the two. So data are the fundamental elements of cognition and are defined as an analyzed raw facts that do not imply meaning. When meaning is attributed to data and when data are processed and analyzed, the data become information. Bakit naging yung data? Basta yung mga data na yan, yung mga nagagather natin sa ating mga patient na very raw. Okay? Once inanalyze mo yan siya, once verified mo yan siya, magiging information siya because it gives you information or knowledge. So consider for instance the number 39. It can be an age, house number, jersey number, and this is data. Pero once tinanong mo, how old are you? Okay? So I am 39 years old. So that becomes an information regarding on your patient. Okay? So the healthcare system builds heavily on accurate recording of obtained data. Paper-based methods may bring inconvenience, especially when it comes to interoperability. So hindi madali. Okay? Sad to say, hindi masyadong practiced ang eHealth sa community dito sa Marawi because none or mostly of the rural health units, okay, or barangay health stations don't have computers, don't have laptops, don't have internet connection. We don't have good enough internet connection here. That's why it is not really practiced in the field, yung itong eHealth. Usually, ang napapractice lang kung nasa center office ka. Example lang natin ang IPH or the CHO. Syempre, sila na yung napaprocess ng data, so meron dong office doon at doon na yung mga pagpaprocess ng data. Pero doon sa pinakababa, sa mga grassroots, okay, sa pinaka-basic, wala. Yan yung hindi, dahil nga, maliit yung budget for health. Okay? So, a number of bigger problems may also emerge pag dahil dahil sa paper-based, sorry, so yung mga paper-based na operation, nagkakaroon ng problem yan, such as continuity and interoperability of care stops in the unlikely event that a record gets misplaced. So, isa pa lang natin, nawala. So, during siege, yung mga barangay health stations na nandoon, nakalagay sa most affected area, so wala ka ng paghahanapan ng record. So babalik ka, back to zero ka. Yun yung mahirap sa paper-based eh. Hindi katulad pag computer, i-encode mo lang, nakastore yan siya for as long as hindi masira yung computer or the hard drive of the computer, your document or information or your data is safe. Okay? Another problem, illegible handwriting possess a misinterpretation of data. Pag pangit yung penmanship ng nurse, okay, ikaw yung sumalo sa trabaho nung previous na nurse, hindi mo maintindihan, di ba? So, nahihirapan din yung incoming na nurse. Another is the patient's privacy is compromised. The traditional paper-based patient records are vulnerable to unauthorized viewing since there is no audit trail of the usage of the chart. So, pwedeng mabasa-basa lang yan ng mga marites sa kapitbahay. Okay, kasi hindi mo natitrace kung sino yung nagbabasa. And at the same time, hindi nakalock yung data na kahit sino na lang pwedeng magbukas ng mga paper. So, another is data are difficult to aggregate. Manual data recording and tallying significantly delays implementation of intervention. Siyempre, tutok na tutok ka sa pagre-record, pagre-report, kung ano-ano pa man dyan. Pero, mas doon nagiging mas matagal yung focus mo. So imbes na mag-intervene ka, magbigay ka ng mga iba't ibang solution sa problems na na-identify mo, hanggang doon ka pa lang sa tallying. So medyo matagal siya na process. That's why kailangan double time yung mga nurses. And lastly is the actual time for patient care gets limited kasi you spend time mostly on the charts or making your charts while assessing your patient. So likewise, for both clinical and community settings, the overall impact of the problems related to manual or traditional data gathering is articulate as follows. So the ability to manipulate large amounts of data, the ability to relate data to cohorts of people who share similar health problems, and the ability to link to genomic data. So yan yung mga ginawang changes, internal and external, ng ating healthcare informatics. Okay? So, in contrast, having a well-managed patient information can have the following benefits. Kung ang implement natin is a well-managed patient information system, ito yung makukuha nating mga benefits. First, the data are readily mapped, enabling more targeted interventions and feedback. So, madaling hanapin kasi nandoon lang sa isang file yan siya and nagkakaroon ng mas mabilis na paper trail. Okay, next is the data can be easily retrieved and recovered. So, in the event of force majeure, the retrieval of patient information is not a problem since the data are automatically backed up. Okay, another is redundancy of data is minimized. Pag ganun na naulit na naman, okay, na-omit kasi na-identify na computer, okay, this is redundant. So we need to change this one. Okay, macho-check mo lang siya na kung na-encode mo na bumalik pala, so ganyan. Another is data for clinical research becomes more available. So madali lang na pag may pumunta sa'yo ng mga nurses, uy, gusto kong mag-undergo ng research, pwede ko bang makuha yung mga paper? So madali na lang, hindi ka mahihirapan kasi kaysa naman sa iba ibibigay mo sa kanya, ibulto-bultong mga papers. And lastly, resources are used efficiently. So, lahat ng mga resources na available sa healthcare unit or sa RHU or sa BHS, available siya at nagagamit. Okay? So, ano na yung mga qualities of a good data? Paano ba natin masasabi na this data is good or bad? So, the nursing process begins with obtaining data through assessing the patient's signs and symptoms. These data are interpreted by the healthcare professional into useful information and a diagnosis. This is then followed by necessary interventions and again ends with gathering new data from evaluating the results. So, without the data, it will be difficult for a health professional to assist the patient. So, ano yung mga characteristics ng data na para masabi natin this is good at hindi to magkakaroon ng problems when you analyze this one? First, the accuracy. It should be accurate. This ensures that documentation reflects the event as it happened. Kumbaga, hindi siya false, hindi siya based sa mga rumors. It is based all on facts. Another is accessibility. This is a data characteristics which ascertains data availability should the patient or any member of the healthcare staff needs it. So kumbaga, gaano siya ka-available lagi, readily available sa atin. Next is comprehensiveness. Data inputted should be complete, and this is done by making sure that all required fields in the patient record are properly filled up. Another is consistency or reliability. Having no discrepancies in data recorded makes it consistent. This means that when John Lloyd de la Cruz is written on the first page of the patient record, it should not be John Lloyd de la Cruz in the next. So, dapat magkakapareho pa rin siya. Another is or consistent. Another is currency. All data must be up-to-date and timely. Okay? And lastly, the definition. The data should be properly labeled and clearly defined. For example, 36 is just an ordinary number unless it is labeled as an age of a person. Okay? So yun ang ating qualities of a good data. We have accuracy, accessibility, comprehensiveness, consistency or reliability, currency, and definition. So what is the situation of e-health in the Philippines? So the developing world suffers from inadequate healthcare and medical services. Isa na tayo doon sa mga third world na countries, okay? So lack of health professionals and infrastructures contributes to this problem, making it more difficult to deliver healthcare to people in rural and remote communities of the developing world. The ubiquity of mobile technologies and availability of internet services in the Philippines create a promising ground for e-health access. So, nung na-endorse dito at gumanda yung mga networks, okay, internet dito sa atin sa Philippines, nagkaroon na medyo hope, okay, na para ma-implement itong e-health. So, what are the factors affecting e-health in the country? So, first factor na nakaka-apekto, okay, ng e-health sa atin sa Philippines kasi hindi masyadong implemented itong e-health is first, limited health budget. Okay? Hindi malaki yung budget na binibigay or percentage ng budget na binibigay para sa health. Paano pa kung dagdagan natin ng e-health, no? So, this is one of many reasons advancement in e-health are postponed. The ICT projects usually require a huge budget, take a long period to implement, and are occasionally seen as risky endeavors. That's why hindi nagta-take ng risk ang ating government because it would cost you a lot. Okay, another is the emergence of free and open source software. In eHealth, the cost of software procurement or development often takes up a huge portion of the budget. So hindi madali na makadevelop ng information system na in one click okay na, tapos na. Ito yung budget, kahit 1,000 peso budget mo, hindi pwede. Aabot yan ng mga millions and then may trial and error din nangyayari. So in addition, using ready-made proprietary software can be limiting at times, especially when users want to modify the software to fit their workflow better. Another factor, okay, is the decentralized government. Under the 7160 or the Local Government Code of 1991, the local government units are autonomous and therefore is control of their own basic health services including the budget. So dahil meron tayong decentralization or nagkaroon ng power yung mga local government units natin to decide on their own, doon na nagkaroon ng problem. Kasi hindi lahat ng LGUs are capable and willing to develop their own. Yan yung mahirap. Kasi may mga, may napapractice sa atin na parang wala lang, okay? Basta-basta lang nakukuha nila yung ira nila, wala silang naibibigay or nai-implement, okay na yun sa kanila. So, yun yung mahirap dahil nga naging decentralized ang ating LGU. Another factor is the target users are unfamiliar with the technology. Especially dito sa atin sa community, makikita mo na yung mga nurses tumatanda na. Matanda na, okay, matagal na kasi sa service. So, you don't expect na masyadong techy yung mga ganong tao. Okay? So, mahirap na ita-train mo pa sila. So, 'di ba? Sobrang hirap niyan. Unless naman din kung tatanggalin mo sila sa trabaho. The problem is to their efficiency kasi matagal na sila sa trabaho. Hindi ka, kasi once tanggalin mo sila, papalitan mo ng bago, yung bago ita-train mo na naman. So, that's another gastos na naman, 'di ba? So, hindi ganoon kadali. Okay? Next is the surplus of digital native registered nurses. Not too long ago, we had nothing to think about except the board exam. And before that, we have to make sure we were qualified to take the exams by completing the requirements. Along with many other adversities, sure, the passing the exams was a reason to celebrate. But I was celebrating yesterday, not tomorrow. So yan yung mga sinasabing cleaning, from the article Cleaning Up published by the Philippine Daily Inquirer September 6, 2011. So because of logistic limitations, government hospitals and health centers are mostly understaffed despite the estimated 200,000 underemployed or unemployed nurses in the country. Okay? So overall, the Philippines is progressing in its use of eHealth for the benefit of its citizen. How eHealth specifically affects community health will be taken up in a greater detail in the next section, which is eto na, the using of eHealth in the community. So, the major goal of community health nursing is to preserve the health of the community. Alam natin yan. We want to preserve the health of all community members. So this is best achieved by focusing on health promotion and health maintenance of individuals, families, and groups within the community. So ano yung mga nakaka-contribute sa atin para ma-achieve natin tong goal natin, nasabi natin, gusto natin tong, ma-preserve yung health. First is the universal healthcare in ICT. So, di ba, na-discuss natin yung UHC, okay, the strategy of UHC. So, in the Philippines, making healthcare accessible to all remains a great challenge. Challenge pa rin yan kasi not all are given equal opportunities when it comes to health. Lack of financial health care coverage leads to high out-of-pocket expenses. The marked mass migration of health professionals leads to remote and rural areas of the country with limited access to specialized health care. Okay? So, a series of health reforms have been implemented. The DOH, through the Administrative Order 2010-0036, outlined the policy directions of universal health care, also known as kalusugan pangkalahatan. This reform agenda has three priority health directions. First is financial risk protection through expansion of national health insurance program, enrollment, and benefit delivery. Another, improved access to quality hospitals and healthcare facilities. And lastly, the attainment of health-related Millennium Development Goals. Okay? So another, ano to, another factor para makakontribute sa pag-achieve natin ng preserving the health of the community is the electronic medical records. The EMRs are basically comprehensive patient records that are stored and accessed from a computer or server. Community health centers have the capacity to rapidly adapt EMRs because they utilize a standard process nationwide. For example, the workflow with a patient at a health center in Quezon City is basically the same as that of a health center at Batanes. So in contrast, EMRs are more difficult to implement in hospitals because each hospital has its own set of protocols. So madaling gamitin yung EMR kasi pare-pareho yung mga EMR na ginagamit natin sa community. Another is the telemedicine. One of the five strategic goals of the DOH National eHealth Strategic Framework for 2010 to 2016 is to capitalize on ICT. This in order to reach and provide better e-health services to geographically isolated and disadvantaged areas, or yung tinatawag nating GDAS, to support the MDG attainment and to disseminate information to citizens and providers through telemedicine and mobile health. So, the WHO defines telemedicine. So, ito yung definition ng ating telemedicine. The delivery of healthcare services where distance is a critical factor by all healthcare professionals using information and communications technology for the exchange of valid information for diagnosis, treatment, and prevention of disease and injuries, research and evaluation, and for the continuing education of healthcare providers, all in the interest of advancing the health of individuals and their community. So there are four elements that are specific to telemedicine. First element, its purpose is to provide clinical support. Another element, it is intended to overcome geographical barriers connecting users who are not in the same physical location. Third, it involves the use of various types of ICT. And lastly, its goal is to improve health outcomes. Okay? So another factor that would achieve, okay, the preserving the health of the community is the e-learning. Health education, which is essential in health promotion and maintenance, can be facilitated by ICT. E-learning is basically the use of electronic tools to aid in teaching. It can be done synchronously or asynchronously or in a combination of both. This can be done in the form of simple instructional videos and information text blast to social network, help groups, and interactive stimulations. So example lang natin during COVID, during pandemic, di ba, nagte-text sa atin yung mga telecommunications na ito, wear mask, don't forget, okay, wash hands, ganito, ganyan. Ano yung mga ginagamit natin or mga preventions natin na against the COVID-19, okay? May mga television commercials, may mga radio broadcasting regarding sa mga health preventions, okay? So, examples of e-health projects in the community, meron tayo dito on page um, 369 and 368 to 369, mga examples ng e-health projects dito sa Philippines that is used in community health practice. Okay, so andito yung Bodyworks, CHITS, EFHSIS, EIMCI, NTHC, RX Box, the surgeries, the shine, the spasms, the speed, the wireless access for health. So, ang dami-daming mga na-implement din sa atin that the similarities among the project and their implementation are noteworthy. So, ano yung role natin sa community health? Ano yung mga roles ng mga nurses sa eHealth? Okay, so community health nurses roles are significantly diverse by eHealth. First is, ito yung mga major role natin. First, pag eHealth nurse ka, you are a data and record manager. As data and record managers, community health nurses monitor the trends of diseases through DEMR, allowing for targeted interventions for health promotion, disease prevention, curative services, and rehabilitation. Another, you are a change agent. The nurses act as a change agents by working closely with the community and implementing e-health with them and not for them. Change agents do not force technology on the community but inform and guide the community in selecting and applying appropriate ICT tools. Another is you are an educator. So the nurses provide health education to individuals and families through ICT tools. They may also participate in making e-learning videos on specific diseases, which the patients can watch during their waiting time at health center. So, may mga ilan sa mga videos na nagawa na, such as yung rabies, okay? Yung, tuberculosis, yan, hepatitis, HIV, yan may mga videos na pwedeng very accessible sa YouTube at pwede nyong i-download yan siya in order to teach the people, okay, in the community regarding on that certain disease. Another role of nurses is you are a telepresenter. So in the event that the patient needs to be referred to a remote medical specialist through telemedicine, nurses may function as a telepresenter. This means that the nurse may need to present the patient's case to a remote medical specialist, noting salient points for case management or case assessment, evaluation, and treatment. This usually occurs via teleconference. Another role is as a client advocate. As client advocates, community health nurses must safeguard patient records, ensuring the security, confidentiality, and privacy of all patient information are being upheld. And lastly, you are a researcher. Using eHealth tools, patient records can easily be retrieved and analyzed retrospectively by community eHealth nurses. They are responsible for identifying possible points for research and developing a framework based on data aggregated by the system. So, an eHealth nurse researcher also pursues continuing nursing informatics education with the goal of developing a research framework which will be beneficial to the community. As a summary, fundamental to technological development is the establishment of human, political, and economic arrangement that ensures the efficient use and application of technology. So kung wala yung wala yung uh, pag-establish ng mga tao, the political and economic arrangement para sa implementation and development ng technology, hindi din maganda yung effect niya sa atin. At pag hindi din at hindi din na-apply or hindi din nagagamit. So what's the use of having an advanced technology if you don't have the enough resources for that? So it's very important that you know how to deal with this kind of system na hindi lang siya hindi lang dahil para maganda, dapat para mas maging efficient yung work mo. Time and again, the purpose of technology is to make our lives easier. So imbes na madaliin yung buhay mo, mas papahirapan mo. So hindi maganda pag ganun. Pag nahirapan ka sa pag-implement ng eHealth, I think it doesn't suit your community. So you need to adjust. Not just, kumbaga, yung community yung mag-a-adjust sa'yo. As much as possible, mag-usap both the nurse and the community health members, and then maghanap sila ng magandang solution for their problem. Okay? So I think that ends my discussion on chapter 15 regarding the eHealth in the community setting. So if you have problems or questions regarding the topics that I have discussed, just scan your books and also PM me. So thank you again and wassalam.